Mental illness is a largely neglected and invisible illness. Its symptoms cannot be detected in a simple blood test. It does not get passed on from one person to another by coughing or touching, and it's an illness shrouded in shame and stigma. Yet its impact is visible and global, with the poor and disadvantaged hardest hit. 1 in 4 people will suffer a mental, neurological or substance use disorder at some point in their lives. Yet many cannot get access to basic medicines or basic mental health care. They simply suffer in silence or in chains. More than 75% of people suffering from a serious mental health disorder in the developing world received no treatment in the previous 12 months. Epilepsy, for example, affects about 50 million people worldwide, 80% who live in the poorest parts of the world. In Africa, 9 out of 10 people suffering from epilepsy go untreated, unable to access simple and cheap anticonvulsant drugs. Patients are often taken to witch doctors and subjected to violent beatings to chase away evil spirits. Yet for just $5 a year, millions could get the drugs they desperately need. Mental health services in many parts of the developing world are clearly woefully inadequate. Mental health is largely ignored in global health. In many countries, funds assigned to mental health care programs are often less than 1% of overall spending on health. Patients, not just in poor but also rich countries, are often forced to remain against their will for weeks, months or even years in psychiatric institutions, restrained by rusting chains, kept in caged beds and denied clothing, food and basic toilet facilities. Quite often, these mental disorders interact with other conditions like HIV and maternal and child health. In the developing world, almost 1 in 5 women experience significant mental health problems during pregnancy and after giving birth. Mental disorders simply push the poor even deeper into poverty. The time to act is now. The WHO Constitution defines health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. Simple, low-cost solutions for the treatment and prevention of mental illness in low-income countries does exist. They're just out of reach. MHGAP is aimed at closing the gap between what is urgently needed and what is currently lacking. A huge gap that can only be closed through stronger partnerships, greater political will and increased funding. The goal of the World Health Organization, according to Dr. Margaret Chan, its Director General, is to see that mental health is integrated into healthcare systems. Governments across the world need to see mental health as a vital component of primary health. We need to change policy and practice. Only then can we get the essential mental health services to the tens of millions in need. With proper care, counselling and medication, millions can be treated for depression, schizophrenia, suicide and epilepsy. MHGAP urges governments, international organisations and all mental health stakeholders to come together and work together. Human resources are particularly crucial for mental illness, especially in Africa and Asia. Caring for the mentally ill relies heavily on trained health workers, not costly technology or equipment. Mental illness is treatable and curable. Treatment is affordable. We simply cannot afford to ignore the global burden of mental health. After all, there is no health without mental health. The time to act is now.